Welcome to Innovative Spine and Wellness, the Scoliosis GTA. I'm Dr. Paul Oakley. In this segment, we're going to talk about the difference between a traditional rigid brace for scoliosis, such as this one. This was donated by a patient of mine from Sick Kids Hospital, who switched this out for a corrective brace, okay, versus a more modern and progressive technology in the ScoliBrace, which is a corrective rigid brace for scoliosis. So first we're going to start with the traditional rigid brace, okay? You can see here that, well, both braces are very similar in their creation, in how they're made, and they're both rigid, okay? And they both do up with Velcro at the front. They squeeze it around the body, the pediatric or patient, they Velcro it on, cinch it up tight. They're both worn approximately 20 hours a day, sometimes even longer. You can see here that if we look at this, generally speaking, it's fairly symmetric in nature, okay? This is the fault of this brace. This is minimally corrective or not at all. It holds the torso, it traps the torso in a rigid, symmetric orientation, thereby isolating the muscles and preventing them from being used. So it weakens and deconditions the spinal muscles that move and hold the spine. So the clinical trials on the traditional rigid braces are not good. They say that, well, it doesn't really prevent a pediatric from getting surgery by wearing these. So a lot of orthopedic surgeons do not recommend use of traditional rigid braces. Let's take a look at the ScoliBrace. You can see how this is very not symmetrical whatsoever. You can see here that the hip is out on this side, pushing the rib cage and torso over to the left. And you can see here that it's wedging in here over the hip. It's more symmetric on this side, but not this side. And the reason why is because the patient actually is oriented in the complete opposite manner. So the reason why the ScoliBrace is so effective is because it's corrective. In other words, along with x-rays, there's digital three-dimensional body imaging of the contour of the torso and spine. These images are then reflected or reversed, and the brace is created in a reverse manner, therefore forcing an overcorrection of the spine and torso. And then when it's worn, it is actually, dramatically overcorrecting the spine and the torso. So the more it's worn, the more correction occurs. So the preliminary evidence coming out on the ScoliBrace is showing dramatic corrections and reductions of curvatures in pediatrics with scoliosis. So that's the main difference between the traditional rigid brace and the new ScoliBrace that's on the market. So contact us at Scoliosis GTA, Innovative Spine and Wellness in Newmarket. We also have locations in Mississauga and Weston, and we hope to hear from you soon. Thank you.